Parkinson's disease is a movement disorder in which the dopamine-producing brain structure, the substantia nigra, stops producing the neurotransmitter dopamine. When 50 to 80% of substantia nigra neurons die, the first symptoms of Parkinson's are noticed. The substantia nigra are two small pigmented arrangements located in the bottom of the midbrain area, the convexity of the brain. Substantia nigra means black substance because of its dark appearance. In addition to resting tremor, twitching, and bradykinesia, other symptoms include shuffling steps, muscular rigidity, small handwriting, lost sense of smell, postural instability, sleep disturbances, constipation, bladder problems, sexual problems, fatigue and loss of energy, cachectic, unexplained weight loss, soft, less understandable speech, diminished facial expression, infrequent eye blinking, depression, and anxiety. Olfactory dysfunction is among the earliest non-motor features of Parkinson's disease. Such dysfunction is present in approximately 90% of early-stage Parkinson's cases and can precede the onset of motor symptoms by years. Neurological conditions with equivalent olfactory deficits include Alzheimer's disease, Down syndrome, the Parkinson dementia complex of Guam. Conditions with lesser or absent olfactory dysfunction include multisystem atrophy, corticobasal degeneration, and progressive supranuclear palsy. Olfactory dysfunction can be useful in differential diagnosis. The drug Sinemet, also called L-dopa, is considered the gold standard medication for Parkinson's disease, and Dr. Andre Barbeau is one of its pioneers. The drug L-dopa consists of two components, levodopa and carbidopa. The amino acid levodopa is the immediate precursor to dopamine, and unlike dopamine, it passes the blood-brain barrier. Levodopa is converted into dopamine by the enzyme aromatic L-amino acid decarboxylase, also called decarboxylase. Carbidopa inhibits decarboxylase and thereby prevents the periphery, the name doctors give the body, from converting levodopa into dopamine. Consequently, dopamine floods the brain and central nervous system, thus relieving Parkinson's symptoms. Carbidopa reduces the required dose of levodopa by 75% and reduces the associated side effects, especially nausea. Prior to the invention of carbidopa, levodopa was prescribed at doses ranging from 2 to 6 grams per day, and there was a B-complex vitamin called Larabec, which did not contain pyridoxine, vitamin B6. Vitamins with pyridoxine can impair levodopa therapy by increasing the conversion of levodopa into dopamine in the body. There's a major problem with L-dopa. L-dopa is tachyphylactic. Tachyphylaxis is when the body has a rapidly decreasing response to a drug following its initial administration. Larger doses of the drug are then required to have the same response. University of Alabama at Birmingham researchers discovered that DNA methylation causes L-dopa to stop being effective after a few years, instead giving rise to dyskinesia, involuntary jerky movements, making life even harder for patients. The team also treated animals with a compound called RG-108, or with methionine supplementation, and saw that they could change the dyskinetic behavior of the animals. Though L-dopa causes DNA methylation, it is more accurate to state that L-dopa increases existing DNA methylation in Parkinson's disease patients. Multiple articles reference DNA methylation in Parkinson's disease, including epigenetic mechanisms in Parkinson's disease, Highlights include the alteration of DNA methylation in Parkinson's disease-related genes and methylation-associated factors changes. Also, PCG1A promoter methylation in Parkinson's disease. In 1982, 11 patients with previously untreated Parkinson's disease were treated with L-methionine for periods from 2 weeks to 6 months. The treatment was well supported, and good improvement in clinical signs, particularly akinesia and rigidity, appeared with approximately 3 weeks, the effect on tremor being less marked. Therapeutic effects were similar to those observed with L-dopa treatment. In 1984, 15 patients who experienced maximal improvement while taking standard Parkinson's disease drugs, Sinemet and anticholinergics, enrolled in an open-label trial which combined standard drugs and methionine. 5 dropped out because of side effects from taking 5 grams of methionine a day. The 10 participants who finished the 11-week trial experienced the following. The range of symptoms reported as improved consisted of increased activity level, greater ease of movement, decreased rigidity and dyskinesia, improved mood and sleep, improved powers of concentration and attention span, clearer and louder voice, and improved muscular strength. In no case did either tremor or drooling improve. Except the 5 who scored 0, all the patients and families at the end of the trial selected to continue L-methionine therapy. Betaine hydrochloride is the hydrochloride form of betaine, a crystalline alkaloid occurring in sugar beets and other plants. Betaine acts as an antioxidant and methyl donor agent versus levodopa-induced oxidative stress and hyperhomocystinemia in the rat kidney. L-dopa therapy has a honeymoon period of approximately 2 years, in which it relieves Parkinson's symptoms, then its effectiveness decreases. Larger doses of L-dopa are required, and as a consequence, dyskinesias, uncontrolled shaking occur, along with the on-off syndrome. When wearing off occurs, Parkinson's patients become junkies to L-dopa, and they have on and off times. Parkinson's patients have to take L-dopa to produce dopamine, but between doses they have off times and have difficulty with movement when no dopamine is produced. Niacin depletion can occur in Parkinson's patients taking the combination of either L-dopa and benzerazide or L-dopa and carbidopa. Anti-Parkinsonian drugs, benzerazide and carbidopa, cause vitamin B6 depletion. 36 L-dopa medicated patients were given 1.5 grams of L-carnosine a day, and it significantly improved neurologic symptoms, including decreased rigidity of the hands and legs, and increased hand movement and leg agility. A high-protein diet, especially dairy products, interfere with the absorption of levodopa, which diminishes the production of dopamine. Breakfast and lunch should be high-carbohydrate meals, with protein being consumed at dinner. The drug entacapone has chemical action similar to that of carbidopa. The drug entacapone inhibits the catecholomethyltransferase enzyme, the COMT enzyme, and prevents the breakdown of dopamine. Entacapone is a dopamine booster and is used during L-dopa wearing-off periods between the doses of L-dopa. Lewy bodies are composed of misfolded clumps of protein called alpha-synuclein. Lewy bodies aggregate in the brains of Parkinson's and sometimes Alzheimer's patients and lead to nerve cell degeneration and mental dementia. Entacapone and tolcapone, two COMT inhibitors, block the formulation of both alpha-synuclein, which plays a role in the pathogenesis of Parkinson's, and beta-amyloid, which plays a role in the pathogenesis of Alzheimer's disease. There are 6 new forms of L-dopa presently being developed. The forms include inhaled L-dopa, dual-layer L-dopa, subcutaneous L-dopa, prodrug L-dopa, polymerized L-dopa, and malevodopa, the methyl ester of L-dopa. Malevodopa has been tested against the on-off condition. Switching Parkinson's patients with motor fluctuations to malevodopa, particularly in the presence of entacapone, could optimize critical periods of the day, such as the morning delay on and afternoon off periods. There are 2 forms of alpha-synuclein and 2 forms of Parkinson's. The long and flat form like linguini, and the spaghetti form, which is more toxic and has a greater capacity to kill nerve cells. Transplanting fetal nerve cell tissue into the brains of Parkinson's patients is a way of regrowing damaged nerve cells. After a successful operation, doctors discovered that alpha-synuclein spread to the newly transplanted areas from existing diseased tissue. The misfolded protein transmits Parkinson's from neuron to neuron. The MAO inhibitor Depronel came into public consciousness in the 1986 PBS special, Case of the Frozen Addict. In the early 1980s, a tainted batch of heroin hit the streets of California and caused junkies to not be able to move. The heroin was synthesized with too much heat and produced the byproduct MPTP, which induced Parkinsonism by destroying the substantia nigra. MPTP is converted into MPP+ by the MAO enzyme. MPP+ is an herbicide known as ciperquat and is chemically related to paraquat. Scientists use MPTP in Parkinson's animal models to test the quality of potential drugs. Doctors use MAO inhibitors as therapy in Parkinson's disease to slow the breakdown of striatal dopamine. About 7% of people with Parkinsonism have developed their symptoms following treatment with particular medications. This form of Parkinsonism is called drug-induced Parkinsonism. Drug-induced Parkinsonism is more prevalent in older people and is twice as common in women than men. Drug-induced Parkinsonism tends to remain static and does not progress like idiopathic Parkinson's. One study reported that 16% of cases went on to be confirmed to have idiopathic Parkinson's. The non-motor symptoms scale total score was higher in Parkinson's disease patients than in subjects with drug-induced Parkinsonism and healthy controls. Symptoms common to idiopathic Parkinson's disease patients but not drug-induced Parkinsonism include urinary symptoms, sleep disturbances, attention deficit, olfactory dysfunction. A number of clinical cues have been highlighted to aid the differential diagnosis between drug-induced Parkinsonism and Parkinson's disease, and these include symmetry of symptoms, relative absence of rest tremor, coexistence of oromandibular dyskinesias, and a less pronounced, if any, response to the levodopa. Finally, preliminary evidence exists for sympathetic cardiac scintigraphy to predict dopaminergic pathway abnormalities to differentiate between drug-induced Parkinsonism and Parkinson's disease. Scintigraphy is a diagnostic test in nuclear medicine, where radioisotopes attach to drugs that travel to a specific organ and are then taken internally, and the emitted radiation is captured by external detectors to form two-dimensional images. MIBG scintigraphy depicts cardiac sympathetic denervation in Parkinson's disease patients, but not in those with drug-induced Parkinsonism. Researchers examined almost 300,000 hospital records from California over 16 years and concluded patients admitted to hospital for methamphetamine or amphetamine use disorders had a 76% higher risk of developing Parkinson's disease compared to those with no disorder. The amino acid N-acetyl-cysteine, NAC, a precursor to glutathione, has been shown to significantly attenuate the reduction of dopamine transporter in monkey striatum 3 weeks after the administration of meth. Therefore, it is likely that NAC would be a suitable substance for the treatment of neurotoxicity in dopaminergic nerve terminals related to the chronic use of meth in humans. In a recent study, Parkinson's patients who continued their current standard of care treatment were placed into 2 groups. The first group received a combination of oral and intravenous NAC for 3 months. The second group, the control patients, received only their standard of care for Parkinson's treatment. Compared to controls, the patients receiving NAC had improvements of 4 to 9% in dopamine transporter binding, and also had improvements in their UPDRS score of about 13%. According to a study presented at the 136th annual meeting of the American Neurological Association, people who moderately consume beer may reduce their risk of developing Parkinson's disease by 27%, compared with non-drinkers. Xanthohumol is a bioactive flavonoid antioxidant molecule found in the flowering hops plant. It is 200 times more powerful than resveratrol, the world-renowned antioxidant found naturally in red wine. In lab tests, the researchers found that the compound could protect neuronal cells and potentially help slow the development of brain disorders. Nilotinib is a drug approved for chronic myelogenous leukemia. The medication inhibits a certain class of proteins, including one called CABL, which is an emerging target for Parkinson's research. The results from a small open-label trial of nilotinib in people with advanced Parkinson's and participants reported improvements in motor skills and cognitive function. Nilotinib, a highly selective BCR-ABL tyrosine kinase inhibitor. In a leukemia study, we showed that xanthohumol strongly inhibited BCR-ABL expression. In various clinical studies, NAC prevented the following therapies from killing cancer cells: nilotinib, xanthohumol, selenium, curcumin, EGCG, melatonin, American ginseng, and berberine. NAC enhanced cancer cell death when used with the cancer drug imatinib. In 2012, ecstasy, also called MDMA, has been shown to ameliorate L-dopa dyskinesia side effects in animal models. However, MDMA has no therapeutic potential in this context, primarily because it is psychoactive, but also because there is evidence that it may be neurotoxic. A novel MDMA analog, UWA-101, that lacks psychoactivity and cytotoxicity, enhances L-dopa benefit in Parkinsonian primates. Researchers at St. Jude Children's Hospital concluded cocaine makes the substantia nigra more susceptible to environmental toxins, like MPTP, and pregnant women who abuse cocaine put their children at an increased risk of developing Parkinson's disease. In 2011, GE Healthcare's DaTscan became the first US FDA-approved diagnostic imaging agent to help doctors evaluate neurodegenerative movement disorders like Parkinson's. DAT scan consists of an injection of iodine and a radioactive cocaine analog mixture. The cocaine lights up the caudate and putamen, parts of the brain that contain the neurotransmitters for dopamine. In a normal scan, these two parts look like twin commas. In a person with Parkinson's, they often more look like periods. Cannabinoids are non-psychoactive products of marijuana. The Michael J. Fox Foundation funded a grant to see if cannabinoids offer neuroprotection in a genetic neurotoxin model of Parkinson's disease. The United States of America, as represented by the Department of Health and Human Services, holds a patent on cannabinoids entitled Cannabinoids as Antioxidants and Neuroprotectants in the treatment of neurological diseases such as Alzheimer's disease, Parkinson's disease, and HIV dementia. In Israel, Parkinson's patients, average age 66, felt relief from pain, tremor, and had improved sleep after smoking marijuana. The effect lasted between 2 to 3 hours. Monoamine oxidase inhibitors inhibit both the MAO-A and MAO-B enzymes. As we age, these enzymes naturally break down certain brain chemicals, including dopamine. Starting at age 45, on average, the MAO enzyme destroys 13% of striatal dopamine every 10 years. Theoretically, if people lived a longer lifespan than they currently do, everyone would eventually show symptoms of Parkinson's disease. The MAO-B inhibitor Deprenel was discovered in Hungary in the 1960s by Dr. Joseph Knoll. In 1975, the first paper on the MAOI effect of selegiline and Parkinson's disease was published. Deprenel delays the need for L-dopa therapy by 10 to 18 months. It reduces the dose of L-dopa by 40% and delays the need for larger L-dopa doses from 2.5 to 5 years. Deprenel, elderpearl, and selegiline are names for the same drug. Deprenel is a selective MAO-B inhibitor, and unlike non-selective MAO inhibitors, which inhibit both the MAO-A and MAO-B enzymes, it will not potentiate tyramine-induced high blood pressure. Tyramine is derived from tyrosine and is a releasing agent for dopamine, noradrenaline, and adrenaline. It is present in aged foods like cheese and wine. When tyramine raises blood pressure, it is called the cheese effect. Razagiline is another selective MAO-B inhibitor. It requires a lower dose than selegiline and does not metabolize into trace elements of methamphetamine and amphetamine like selegiline, so it feels cleaner. Dopamine agonists directly stimulate the nerve receptors in the brain that normally would be stimulated by dopamine. Dopamine agonists are not converted into dopamine. The drug acts as dopamine. Dopamine agonists may be used in the early stages of Parkinson's to reduce symptoms and delay the need for L-dopa therapy and related side effects. Dopamine agonists are also used in late-stage Parkinson's, when L-dopa is no longer able to adequately control symptoms. Side effects for dopamine agonists include drowsiness, vomiting, blood pressure shifts, feeling like you might pass out, hallucinations, falling asleep during a daily activity, pathological behavior. Patients on dopamine agonists have about an 18% chance of becoming a compulsive gambler, an out-of-control shopper, hypersexual, or acquiring a food disorder. In 2008, the Michael J. Fox Foundation funded a study featuring the drug naltrexone to treat impulse disorders for patients taking dopamine agonists. Naltrexone is prescribed for drug and alcohol addiction. It is an opioid antagonist, and at lower doses, it can be used to treat Parkinson's. The following audio excerpt features Lexi. Lexi once tried a dopamine agonist, and here she recalls her experience with the drug.
So I started on the PD agonist. The one that I started on was Requip, and that was a disaster for me. I had a lot of side effects with that, one of them being falling asleep while driving 4 times in rush hour traffic.
Oh, my goodness.
Oh, yeah, that was pretty serious. And another one was I had a compulsive shopping addiction. And I'm not the kind of person, I'm a woman, most women like to shop. I'm not a woman that really likes to shop that much, but I had this compulsion not to go to Nordstrom, but to go to the Goodwill. And I could not pass the Goodwill store that was about a mile from our house on my way home from work. I just could not pass it without stopping there. What is wrong with me? It's just like my steering wheel was just heading towards that Goodwill. And I would spend an hour in there or longer until my husband would finally call me and ask me where I was. And I got to the point where I was lying. I was telling him, I'm at the grocery store. I'll be here pretty soon.
A French appeals court made GlaxoSmithKline pay 197,000 euros to a married 52-year-old Frenchman, a father of 2, who claimed the drug Requip turned him into an internet gambling addict in which he lost his family's life savings, and then turned to theft to feed his 82,000 euro habit. He exposed himself on the internet and cross-dressed, and became a compulsive gay sex addict, and his sexual encounters led him to be raped. He attempted suicide 8 times. His abnormal behavior started in 2003 and ended in 2005, the dates he started and stopped taking the drug Requip. In a second article about Parkinson's patients gone wild, 2 men started to smoke crack cocaine after starting dopamine agonists. A 70-year-old man became anxious, started fistfights, he became hypersexual, and compulsively ate sweet foods. A 44-year-old man became anxious, compulsively gambled, collected old lawnmowers, old engines, coins, baseball cards, and garbage. The crack smoking and other behaviors ended after they quit taking dopamine agonists. The National Parkinson's Foundation has an impulsive-compulsive disorder questionnaire, and here's the question on page 1. Do you or others think you have an issue with too much gambling, sex, buying, or eating behaviors? Sex, such as making sexual demands on others, promiscuity, prostitution, change in sexual orientation, masturbation, internet or telephone sexual activities, or pornography. Deep brain stimulation is a surgical procedure that provides a tiny electric current to structures of the brain in order to block motor symptoms of Parkinson's. Electrodes are implanted in the brain where nerve signals generate tremors. Wires connect the brain to chest, where an implanted pulse generator with a battery is located. Deep brain stimulation does not slow the progression of Parkinson's. It provides symptom relief. The 3-part procedure takes from 4 to 6 weeks and is reversible. Deep brain stimulation improves motor functions of Parkinson's disease, but can cause cognitive side effects such as impulsivity. A University of Arizona study found increased instances of impulsivity when the pulse generator was on, as compared to when it was off. According to Dr. Frank, there are some reports of impulsive behavior with deep brain stimulation, including gambling, just not to the same extent as dopamine agonists. Anticholinergic agents act by blocking acetylcholine receptors. Acetylcholine is a neurotransmitter which works in conjunction with dopamine to produce smooth bodily movement. A decreased amount of dopamine leads to an imbalance between dopamine and acetylcholine. Anticholinergics are used in early untreated Parkinson's as monotherapy. They are also used as adjunct therapy for patients taking L-dopa. Amantadine was originally an antiviral therapeutic agent for the influenza A virus. For Parkinson's disease, amantadine hydrochloride is a weak antagonist of the NMDA-type glutamate receptor, increases dopamine release, and blocks dopamine reuptake. This makes it a weak therapy for Parkinson's disease. 40 Parkinson's patients on levodopa and dopamine agonists were treated with 300 milligrams of amantadine daily. The therapy reduced dyskinesia by 45%, but the benefit lasted less than 8 months. The amino acid tyrosine is converted into levodopa, which is then converted into dopamine in the brain. Tyrosine is not normally prescribed for Parkinson's disease because patients have a known tyrosine hydroxylase deficiency due to neuronal degeneration. Tyrosine hydroxylase is the enzyme which converts tyrosine into levodopa. In a 1985 French clinical trial, the amino acid tyrosine was tested against the drugs L-dopa and a dopamine agonist, with 5 Parkinson's patients taking each dopamine-producing supplement. At the end of the 3-year trial, researchers concluded, for some patients, 3 years of L-tyrosine treatment was followed by better clinical results and many fewer side effects than with L-dopa or dopamine agonists. Like any other drug or supplement, there may be a number of reasons to not take tyrosine. The reasons range from high blood pressure to schizophrenia.